Urine is a waste product that is produced by the kidneys in their process of cleaning the blood. The urine then leaves the kidneys and is collected in the bladder. Urine can be harmful to your kidneys if it moves from the bladder back to the kidneys. Therefore, it is important to empty the bladder on a regular basis. 4 to 6 times a day is appropriate depending on your fluid intake, diet, and medication. Take your time to ensure that the bladder is emptied completely each time, as urine left over in the bladder may lead to infection in the urinary tract. In this film, you will learn step by step how to empty your bladder. It is relatively simple, but will require some practice. Start by washing your hands thoroughly with water and soap. Remember also to wash your thumbs. Alcohol hand gel can be used if you don't have access to washing facilities. Make sure you have all the equipment you will need before you start. You will need a catheter, a urine bag, intimate wipes or soap with neutral pH value, and water to clean your penis. A drape and a pantler may also be useful. Remove the white dot from the adhesive spot. Open the peel pouch 2 to 3 centimeters. Fill the pouch with water until it reaches the connector. The catheter must be left in water for at least 30 seconds to activate the coating, making the surface smooth. Cold water will make the catheter stiffer. Lukewarm water will make the catheter more flexible. Attach the adhesive spot to a clean surface, or instead, place the pouch on a hook if preferred. The pouch must hang vertically so that you can easily reach it when you're ready to use it. Pull your trousers and underwear down. You may use a pantler for holding your clothes in place. To avoid wetting your clothes, you may place a drape under your penis. To prevent pushing bacteria into the urethra and bladder, you must first clean the head of your penis properly. Gently pull the foreskin back and wash the head of the penis. To remove any bacteria that might be present at the opening of the urethra, you should clean your penis, starting at the urethra and working outward. Use each wipe only once. Connect the urine bag to the funnel connector of the catheter, but make sure you only touch the connector. Now place the urine bag in a secure position. Make sure that the catheter does not touch anything before you insert it into the urethra. If it does, discard the catheter and use a new catheter. A catheter that has been in contact with the sink or your skin may be contaminated and could potentially cause infection. Hold your penis pointing upwards and towards your stomach. This will ease the insertion of the catheter as the natural S shape of the urethra is changed into a U shape. Provide a gentle pressure to the head of your penis in order to open up the urethra. To help insertion of the catheter, it is important that you relax. Slowly and gently insert the catheter into your urethra. You may feel some resistance when the catheter is passing the prostate and the sphincter, so be gentle. Insert the catheter until it reaches your bladder and the urine starts to flow. Then continue for a few centimeters further. When the flow stops, move a little and straighten yourself up to make sure that the bladder is completely empty. Withdraw the catheter slowly to ensure that you drain any remaining urine at the base of your bladder. Once any additional flow of urine has finished, slowly withdraw the remainder of the catheter. Disconnect the urine bag and the catheter. Empty the bag before disposing of it. You can dispose of your catheter and the packaging in your household rubbish. Do not flush it down the toilet. Wash your hands and you have completed the process. The catheterization procedure must always be carried out under guidance from a healthcare professional. The instructions provided in this film are only intended as follow-up to the advice you have already been given.